Good morning, and could I have Dan and Tony and Dr. Solmesi come up? We're going to start with an interview with Tony Bach from University of Washington with Dan Diaz, who is the husband of Brittany Maynard, to talk about the experience of physician-assisted death.
Inviting us to speak. I am very glad to have the opportunity to start with a real story.
I can't hear you.
Okay, sorry, I will move this closer. That a little better? No. It says it's on, but maybe I need to be even closer. There. Thank you. It's a pleasure to be here, and I am honored to start with a real story to anchor us in what's happening now. Mr. Diaz and I agreed to be on a first-name basis for this part of the interview, and we are really grateful that you have come to share your experience, Dan.
Thank you.
Thank you. So most of us, I think, are aware of Brittany's story at some level, like the People magazine level,
Sure.
right? I saw the YouTube video like a zillion other people, but what really happened?
Thank you. Good morning, and I, in the interest of time and to be efficient, I prepared some opening remarks and a few slides just to provide everyone with more than just the media sound bites as it pertains to Brittany's case. And then we'll have some Q&A for sure. So getting to that, my name is Dan Diaz. And I'm Brittany Maynard's husband. Brittany died November 1st of 2014. We met in 2007. We were engaged and got married on September 29th of 2012. We'd bought a house and just started settling into our lives together. A few months after our wedding, Brittany started having headaches that would wake her up in the middle of the night. She'd get sick, start vomiting, be unable to go back to sleep. That went on for several months. On New Year's Day of 2014, I had to take Brittany to the hospital because the pain was getting too intense and something seemed terribly wrong. After an MRI, they discovered that Brittany had a brain tumor, that it was very large, and that there was no cure, only certain treatment options. Just 10 days later at UCSF Medical Center, Brittany endured a 7-hour brain surgery simply to debulk. Essentially, it's to remove the tumor material that they could safely get to, so that to create enough space in her skull so that the current symptoms would subside. 3 to 5 years of life was the time frame that she was given. She was only 29 years old. Unfortunately, just 2 months later at the first follow-up MRI, the tumor showed signs that it was growing aggressively, indicative of a glioblastoma multiforme. And they then informed Brittany that 6 months was all the time that she had left. So Brittany was determined to live, and we researched every treatment option that was available, and that was both here in the United States as well as internationally. Unfortunately, the option of chemotherapy and radiation, which standard protocol, those might give her 2 or 3 months on the back end, but she would start feeling miserable right away from the harsh side effects of those treatments. I'm not afraid to die, Brittany told me one day. By the way, the emotion just comes, but I'm doing okay. I'm not afraid of death, she said. Death does not have that power over me anymore. Those words were not just lip service. I knew Brittany truly meant that. She did not fear death. But I am afraid of suffering, she said, especially since I will die anyways. I would prefer to die gently, not struggling and in pain. Early on, Brittany brought up the topic of medical aid in dying. At that time, it had been available in Oregon for 16 years, but it was unavailable to her in California. The parameters of the program, 2 physicians independent of one another have to agree this person is terminally ill with 6 months or less to live. They must be mentally competent. They have 6 months or less. They make the request both verbally and in writing. There's a 15-day waiting period. There's witnesses involved. These are the safeguards that are in place, and Brittany felt incredibly protected going through this process. Now, those are the parameters of the program, but as far as the reasons for pursuing it, the fear of being tortured to death if the brain tumor was allowed to run its course, that was the one thing that terrified Brittany. It had already been explained to us by her medical team, and a simple search on the internet will give the list of the horrific symptoms that a person with a brain tumor might endure as they are dying. But on top of that, both Brittany and I each had a friend whose parent died, one of a GBM, the other of a stage 3 brain cancer, so we knew what was coming firsthand. And that included pain that could not be alleviated with morphine. Dilaudid is 4 times stronger than morphine, and Brittany was on some pretty hefty doses of Dilaudid. Personality changes, where one minute the individual seems normal, the next minute they might be agitated, cruel, and violent. Seizures that become increasingly frequent and severe. The small seizures would leave her unable to speak for 20 to 30 minutes. The full grand mal seizures, those would leave her exhausted, with blood coming out of her mouth sometimes because she's bitten through part of her tongue. That's just the reality of what she was living with. The probability that she would go blind as the tumor grows and puts pressure on different parts of the brain. The likelihood that she would lose the ability to speak and communicate altogether. It's not uncommon for a brain tumor to cause a stroke. And depending on what part of the brain is damaged due to the lack of oxygen during the stroke, the person could lose motor function, the ability to stand, walk, and swallow. Partial paralysis was likely, complete paralysis a possibility. Brittany said, "I will not die that way." Why should I be forced to? Any assertion made that in 100% of the cases we can control the terminally ill patient's pain and suffering at end of life, that's simply not true. And we saw that firsthand from our friends' parents. Brittany decided to live the life that she had left to the fullest. I took a leave of absence from work. Brittany found a house for us to rent on Craigslist in Portland. She established residency. We found a new medical team, said goodbye to our friends and family, packed up half of our house in California into a U-Haul, and drove 600 miles north. Nobody should have to go through that, leaving home like that, after being told that you have 6 months to live. Once we were in Portland, Brittany then applied for, qualified for, and was finally granted the prescription for medical aid in dying. That was in May of 2014. But that wasn't her focus. She put the medication in the cupboard and she focused on living life. Brittany's passion was being outdoors in nature, so we went to Yellowstone National Park. She hiked glaciers in Alaska with a friend, a physician, who's also a friend of hers who happens to be a physician. We went to Olympic National Park in Washington, Hood River in Oregon, took a helicopter tour of the Grand Canyon. And in addition to focusing on living life and doing the things that Brittany valued, we also sent her packet of medical information to all clinical trials that showed any glimmer of hope. When you have cancer, you fight. I take a moment to emphasize this because the media incorrectly focused its attention on the death with dignity law. And there are groups that seem to suggest that if a person applies for this program, that they've somehow given up. That couldn't be further from the truth. When you have cancer, you fight. And having this medication emboldened her to fight. Up until Brittany received the prescription, she could not escape the torture that the brain tumor could exact upon her. But all of a sudden, because of simply having the prescription, that fear vanished. Brittany had taken control back from the tumor. Brittany died gently on November 1st, 2014. Remember, she received the prescription in May, a full 6 months earlier. Within 5 minutes of taking the medication, she fell asleep very peacefully. Within 30 minutes, her breathing slowed to the point where she passed away. That was the gentle dying process that this program afforded her. That is not the dying process she would have experienced if that brain tumor would have continued to run its course. A quick side note regarding the terminology, because this was important to Brittany. Medical aid in dying is a term that you'll hear me use. There are those that use the term suicide, or they try to conflate euthanasia, or they'll even use the term physician-assisted suicide. The term suicide is neither applicable nor appropriate in describing this medical practice. My wife, Brittany, wanted to live. A suicidal person wants to die. That term suicide is insulting to terminally ill individuals. Brittany was not depressed, despondent, or making irrational decisions, all of those being the characteristics of a person who is suicidal. A terminally ill individual that applies for this program is not choosing between living and dying. The living part is no longer on the table. That's not an option. They are only choosing between two different methods of dying. One is gentle, peaceful. The other would be struggling and in pain. And one last note, and this is also straight from Brittany, medical aid in dying is not at odds with palliative or hospice care. Brittany had a wonderful palliative care team at OHSU, and the support that we received from the hospice facility was immeasurable. This program is very narrowly focused, and it affords a very small number of individuals like her, and they'll talk about the data later, but in Oregon, it's 0.3% of all deaths over the past 20 years in Oregon, just as an example. It affords them a great deal of relief. So thanks for allowing me to share the more complete story of Brittany Maynard, just so that people understand more than just the snippets that were in the media.
So Dan, thank you so much for that. It's a powerful story. I was wondering if you would mind going back to the time when she was starting to think about this, when Brittany was starting to think about physician aid in dying as an option. And I was wondering if you could say more about what that process was like for her. Did she go back and forth? Did it come to her? What was that like?
So for Brittany, she was an undergrad at UC Berkeley. And in one of the classes that she took, medical aid in dying was something that was discussed. So she had, from that, she knew that it was a program that was out there that was available in Oregon. I hadn't heard anything about it. I didn't know about it. For me, my default was, I don't know, end-of-life care. That's hospice, right? I didn't know anything more than that. I mean, why would I? Both Brittany and I, healthy individuals, never had to really face any of that. But very early on, Brittany brought it up, and just to quote her, she says, Dan, I'm going to fight this with everything I have, but if shit gets bad, we're moving to Oregon. Huh. And it was just that acknowledgement that, okay, we fight, but if things get to the point where, you know, those seizures continue, the increase in severity and frequency, and essentially to avoid what our friend's parents endured at end of life, she was just hedging against that to say, all right, so we'll control for that.
So she kind of presented this to you.
Yeah. If
this gets bad, we're moving, I'm getting ready for us to move to Oregon.
Right.
Yeah. Did she ever think twice about that? Was that a hard decision to come to? It's a big it's a big thing to do.
Right. And so in that regard, of course, hearing about what Death with Dignity in Oregon was for the first time, I had to think through it. It's like, wait, well, what is this? And after I researched it, or we had that conversation, I quickly recognized that if I was in her shoes, I'd be saying the exact same thing. That I just want to make sure that I have this option. But to be clear, the only thing that Brittany was pursuing was to have medical aid in dying as an option. It's never a goal to utilize the medication. The hope is that you don't have to use the medication.
So even when you moved to Oregon, she wasn't dead set on saying, this is definitely what's going to happen.
No.
Is that what you're saying?
Exactly. So our goal was, we moved to Oregon, she has this option, she received that prescription, and that's testament to this. She received that prescription, she applied for, qualified for, received that prescription in May. She puts it in the cupboard, and we did the things that Brittany wanted to do, in addition to researching how we can extend her life. Her focus was never that medication. So what, to be honest, that we have sequelbarbital in the house? That's the prescription. It's a barbiturate. It's been around for 80 years. That's the sleeping medication that is afforded to her. We had just as lethal medications already in the house. Like I mentioned, the Dilaudid, the morphine.
So once you got it, once she went through that procedure and got the medicine, and it was in your
in the cupboard there.
In the cupboard, did she keep? What was the discussion like at that point? Was she done talking about it for a while? What happened?
In a sense, the relief that just having the medication provided her, it allowed Brittany to focus on living life, because she no longer had to be so terrified of the dying part.
Yeah. Now, I'm going to ask on this because I've heard it from other patients and families, and I think it's an interesting point. Can you say something about that? What was it that allowed her what was it about having the medicine that allowed her to do that?
And the answer to that revolves around knowing how a brain tumor might end her life, that she no longer had to be concerned that if she suffers a stroke, as an example, that she is blind, paralyzed, stuck, basically trapped in her own body, dying as a suffering mass lying in bed, with tubes coming out of her, of course, because there's no way to get her up to go and use the bathroom. And so it was the knowledge that when it gets to a point where Brittany is no longer living through her days, she's only suffering through her days, then it does become a question of, it's not just, it's a matter of quality of life, not just quantity. And that's the thing. Modern medicine, the things that we can do and extend and keep a person alive and happy and productive, it's amazing. But along with that, it's also just the recognition that, yeah, but every single one of us in this room, we do eventually die. Yeah. And how that dying process goes, that's what, was Brittany's concern, that she wanted to make sure that would be a gentle dying process.
And when you brought this up with the doctors that were taking care of Brittany in California and in Oregon, I don't know if you brought them up with the doctors in California because it wasn't legal then, what did they do that was helpful and not helpful? Can you give me maybe an example of one and the other?
The conversations in Oregon were much more relaxed, much easier. In California, there was, well, obviously, because in California, the practice hadn't, the legislation wasn't passed yet. Yeah, so in that regard, in California, there was some hesitancy versus in Oregon. We could have these conversations, and that's actually something that the LA Times wrote a piece on this, and it came out, I don't know, 6-9 months ago. One of the unexpected benefits of medical aid in dying. I'm sitting there going, what do you mean unexpected? obviously, clearly, in my mind, this makes sense, but that's because I've, I guess, been working in this for the last 4 years. That unexpected benefit is that physicians are saying that their patients are much more willing and likely to have conversation about end of life. And so a person may come to a physician and say, hey, I'm suffering from certain ailments. Am I a candidate for that medical aid in dying? And the doctor's like, no, you're not. You're nowhere near that. Yeah. But what it does allow is for that physician to then have this conversation with that patient and identify clearly there's portions of that person's care that are not being properly addressed. Well, come on in. Let's have a consultation. Let's talk about that. No, you're not going to get, you don't qualify for medical aid in dying. But there's other things that we can do to address that person's concerns and fears.
Can I ask one more thing related to this? Because, and I will say we just have a couple of minutes left.
Sure.
I do think there are people in the world who are palliative care practitioners and others who say, wow, I'm not sure we really need this to take care of people's symptoms. That's one thing. And then the other thing is that they say, well, I just don't think this is right. I just don't think this is right. I think they have moral concerns about it. And I was just wondering about what your reaction to those things are.
So that's the strength of this legislation. It's an option. It's an option for the patient. It's an option for physicians to decide if they want to participate in. It's an option for the pharmacist. So if there is an individual, luckily, with 73% of the population agreeing with Brittany that a terminally ill individual should have the option of medical aid in dying, whenever I've gone to testify at state houses, speak with legislators, or meet with doctors, I'm in pretty good company. But to that point, if somebody is not quite there yet, or for religious reasons they're opposed, totally fine. I'm Catholic. And the church, the leadership of the Catholic Church is opposed to medical aid in dying. The congregation, the people that I go to church with, 70% of Catholics nationwide agree with medical aid in dying. So if there are those that are opposed, fully respect that. And that's absolutely fine. They do not ever have to avail themselves of it.
Last one. My last question. Can I ask one more? What was it like to be with her right at the time of death?
Because Brittany, and this was just her personality, it's one of those moments where I just think, yeah, I wish everyone could have known her. Because of her own self-advocacy and just taking control of, and being so determined, it really alleviated so much pressure from the rest of us. My role was to support Brittany. What all the treatments, all the scans, everything that she was going through was just to be supportive of her. And it truly was a gift because then, and I've talked to family members whose loved ones have died of cancer in ways that were pretty horrific. And I recognize how much of a gift that was, that Brittany was thinking not only of herself, but also of the rest of us, that there isn't any of those feelings of guilt or should we have done or could we have tried. There isn't. Brittany, as far as that, with just the love that she had in her heart, looking out for herself, one would say, yeah, that was certainly her primary concerns, but it also was a huge relief to the rest of us. So,
thank you so much.
Thank you.